Zero radiation, office-based, low-risk, low-cost renal entry. Percutaneous renal entry is a very useful tool, either exclusively for the purpose of drainage or to work inside the kidney for diagnostic or therapeutic purposes, tumors, stones, etc. Hi, I want to make an invitation. The Latin American Interventional Ultrasound School celebrates 27 years training specialists. For this reason, we organized a workshop on office-based renal entry without irradiation. We will share 2 days of intense work in a relaxed and informal atmosphere. The participants will be trained with practice with ultrasound equipment, ultrasound-guided percutaneous lab, and we will also analyze renal enter procedures done during the last 30 years, comparing especially the techniques, tips, instrumental, and the maneuvers we did then with those we do now. The workshop will take place on Saturday 14th and Sunday 15th November 2020. It will be in Necochea, province of Buenos Aires, Argentina. We want to generate enthusiasm using this tool among those who today do not perform renal percutaneous enter. Also, among those who enter using only fluoroscopy and want to migrate to the ultrasound technique. And finally, also invite those who use a mixed technique and would like to be trained in totally ultrasound guided mode. Thank you. See you on November. 1989 to access the kidney percutaneously. From the beginning, radiation exposure to the patient, the surgeon, and the OR team was a serious concern. All our efforts were focused in entering the kidney, assisted in an ultrasound-guided way, sometimes reducing, but most of the times avoiding radioscopy. Our 30 years experience shows that zero radiation access technique is possible and safe. Minimally invasive and low risk, not synonyms. Two different concepts. Totally ultrasound-guided access allows a very low risk and precisely focused renal entry, with continuous monitoring of the percutaneous instrument. Combination of percutaneous technique and local anesthetics avoided the risk of general anesthesia. Cost containment in low economic resource countries. Ambulatory and office-based renal enter avoid for suitable patients the nosocomial infection-related problems